Be getting started in just a moment here. Thank you all for joining us. Sam, are we good to go?
Yeah, you can go ahead.
Okay. Good afternoon, and thank you all for joining the Walk Cares Fund team and our guest panel for a webinar on caregiving and brain health. For those of you who aren't familiar, Walk Cares is the state's new long-term care insurance program for workers. And our Walk Cares Conversations webinar series is designed to give you a high-level overview of a topic related to caregiving and long-term care. And this month we are talking about brain health. We know that brain health is an important component of your overall health, especially as you age. And there are many ways that your brain health can be impacted over your lifetime, including diseases like dementia or a traumatic brain injury, as well as many things that you can do to help keep your brain healthy. We also know that symptoms of brain conditions often drive a need for long-term care, which we'll talk about more in just a moment. I'd like to go ahead and start by introducing myself and our panel. I'm your host, Kristen Mackey. I'm the Community Relations and Outreach Program Manager for Walk Cares. And I'll go around and have each panel member introduce themselves briefly. Maria, we'll start with you.
Yes, good afternoon. My name is Maria Anacada. I am a social worker and care consultant at the Alzheimer's Association, Washington State chapter, and we provide resources, services, and information to people living with dementia and their caregivers.
Thank you. And Lynn.
Hi, everyone. I'm Lynn Cordy. I work with Aging and Long-Term Support Administration, which is a part of the Department of Social and Health Services. And I do dementia care program and policy work. So I coordinate our Washington State plan to address Alzheimer's and other dementias and the group that implements it called the Dementia Action Collaborative. It's nice to see you all today.
Thank you. And Monica.
Hi, everyone. My name is Monica Vinson, and I'm a medical speech language pathologist at Mason General Hospital. I'm also a certified dementia practitioner, so I do a lot of work supporting patients and their families with dementia, as well as acquired brain injuries. And I'm so pleased to be here today.
Thank you. And Dr. Rhodes.
Hi, everyone. Chris Rhodes. I'm a neuropsychologist here at Memory and Brain Wellness Center at the University of Washington School of Medicine in the Department of Neurology, and get to work with Lynn as part of the Dementia Action Collaborative as well.
Fantastic. Thank you all. So we are going to get started with some remarks from our panel members, and then we will have an overview of the Walk Cares Fund program to share with you, and finally an opportunity for audience Q&A. You are welcome to go ahead and start entering your questions using the Q&A button as they come up for our panel to answer later in the webinar. And the slides and recording will be posted on our website later today at walkcaresfund.wa.gov/webinars. And before we get started, I just want to define really quickly what we're talking about when we say long-term care and caregiving. So long-term care is help with activities of daily living like bathing, eating, dressing, preparing meals, grocery shopping, and more. It does not include medical care, like doctor's visits and treatment for medical conditions. Long-term care can cover a broad spectrum of needs and circumstances, including for younger people who have been unexpectedly injured or become disabled or ill. And a lot of people don't realize how many different services and supports are included when we talk about long-term care. We often think about it as care in a residential setting, like a nursing home or assisted living, but it can also include care provided in your own home. And in fact, many people with long-term care needs can stay in their own homes with the right supports in place. It's also very common for family caregivers to not realize that they are a caregiver. You might go to your mom's house a couple times a week to cook meals, drive her to appointments, and make sure she's taken her meds, which are all common care activities. And in fact, the majority of this type of care is provided on an informal basis as unpaid care from a family member, a friend, or a neighbor. And before we get started, I'm going to go ahead and launch a quick opening poll for everyone. If you could take a moment to answer the questions on your screen to help us learn a little bit more about who we have in the audience today, that would be great. I'll give you just a minute to fill that out. All right. And I'm going to go ahead and cut it off there. So it looks like we've got quite a few folks, about 39% who work in long-term care or a related field. And we have a lot of folks who either currently are providing unpaid care to a family member or a loved one, or have done so in the past. A lot of folks say they're somewhat familiar with brain health as a topic. So hopefully there will be some good information for you here today. And then also only a few folks who say they're already very familiar with walk here. So hopefully that section of the presentation will be useful for you as well. And with that, I am going to go ahead and turn it over to Maria for our first panel member.
Yes, thank you. And I know that some of our attendees may already know this, but I wanted to make sure that we're all on the same page with some important definitions. Our mission at the Alzheimer's Association references the end of Alzheimer's and all other dementias. So let me tell you a little bit about dementia and Alzheimer's. Dementia is an umbrella term to describe a range of symptoms associated with cognitive impairment that could include memory, thinking, language, problem solving, and other abilities that are severe enough to interfere with daily life. Alzheimer's is the most common cause of dementia, accounting for 60 to 80% of reported cases. There are also many other conditions that can cause symptoms of dementia, including some that are reversible, such as vitamin deficiencies or thyroid problems, which is why it is so important for people to follow up with their primary care physician when they notice any changes to their memory. Often dementia will start out slowly, but with time, it might get worse if you or someone you know is experiencing memory difficulties or other changes in your cognitive abilities. Don't ignore them. Even the smallest symptoms, please talk to your doctor as soon as possible to determine the cause. There are many benefits to receiving an early and accurate diagnosis. So including the opportunity to plan for the future, access support, and explore treatment options. Next slide, please. In this photo on the left is what a normal brain looks like, and on the right is what a brain with Alzheimer's looks like. Alzheimer's disease leads to nerve cell death and tissue loss throughout the brain. Over time, the brain is going to shrink, and it dramatically affects nearly all of the functions in our body. So in someone with Alzheimer's, the brain is physically deteriorating. Next slide, please. Alzheimer's and dementia have such profound effects on individuals, families, and whole communities. All of us should be equipped to recognize the warning signs. There are 10 key warning signs and symptoms of Alzheimer's, which can be subtle. Please note that it is possible for people to experience one or more of these signs in varying degrees. It is not necessary to experience all of them to raise concern. In respect to time, I'm not going to read them all, but these are all incredibly important signs to keep an eye out for. Memory loss that disrupts the daily life. So for example, forgetting food on the stove, and that could lead to, not only burnt food, but also the risk of a fire. Difficulty completing familiar tasks, so not being able to cook a family recipe from memory anymore. New problems with words or in speaking or writing, so not being able to find the right word to convey verbally could be one of the signs. Misplacing things, and the key here is losing the ability to retrace steps. So many of us might put the remote control in a different place just because we get distracted by a phone call. We might be able to stop and think where that last place we were at. That's where the remote control might be. But in a person with dementia, that reasoning may not be present. So they will be often unable to find that remote control. Next slide, please. So in addition to the excitement advancements in the treatment, there's more research being done about the importance of brain health to reduce the risk of Alzheimer's disease and dementia. There are several risk factors for cognitive decline and dementia. Some, such as age, we cannot control, but there are things that we can control to improve our brain health. Increasing key healthy habits may lower the risk of cognitive decline and possible dementia. Overall, what's good for the heart, it's good for the brain. So controlling the blood pressure, managing diabetes, keeping our consumption of saturated fats to a minimum. Research is still evolving, but evidence is strong that people can reduce the risk of cognitive decline by making key lifestyle changes, including participating in sports, getting moving, eat right, maintaining a healthy weight, challenging our mind, learning something new, or participating in arts, getting moving, regularly engaging in physical activity that increases your heart rate, and eating right. As I mentioned before, healthy, balanced diets are good for your body, including your brain. So next slide, please. And lastly, I will quickly cover some of the services and supports that we offer. Our 24-hour helpline is confidential, and master's level clinicians will provide resources and interventions regarding behavior management, future planning, financial, and care planning decisions, among other topics. We also offer educational webinars on safety issues, effective communicating strategies, responding to challenging behaviors, etc. A variety of support groups providing emotional support, social and educational support to people with dementia and their caregivers. Next slide. We also offer dementia care consultation in King and Snohomish counties in English and Spanish, and services through the Family Caregiver Support Program, providing practical interventions and services through evidence-based assessments. We also offer in-person or online consultation through the Memory Hub in Seattle. And that's what I have. So thank you.
Thank you so much. And next we are going to go to Lynn.
All right. Can you hear me okay? All right.
You sure can.
All right. So thank you, everybody. It's nice to be here again. I'm going to talk a little bit about some resources. I think one of the things that we find when we go out and speak in public is that people want to find things. And very often there are resources there that they just don't know where they are or how to find them. So if we go to the next slide, what I do want to mention, and I'm not going to talk about the Alzheimer's Association because Maria just did that, But I work with a lot of people with dementia, even people in my own workplace who just ask questions. And I always give them two resources. One is the Alzheimer's Association because of all the great resources that Maria just shared. And the other one is related to a program called the Family Caregiver Support Program, which is available statewide. It is offered through our 13 area agencies on aging. And if you are a family member who's caring for somebody with dementia, you know, if unpaid family caregivers can get support in our state, they can help you find resources and services in your local area. They can help you find a consultation or maybe even a counselor if that's something that would be useful to you. They can help you get training on certain caregiving topics. A lot of information is available around Alzheimer's and dementia that we would lead you to. Looking for respite care services, whether it's adult day services or home care services. We even have programs through Family Caregiver Support to help with supplies, like incontinence supplies. This varies by which AAA you're in, which area agency, but sometimes they can help with these caregiver like equipment that will help around the home or supplies. And sometimes it's just a place to talk to somebody who understands your story, who can help you figure out what are some steps that you could take in your own caregiving journey. You know, what are some of the problems you're having, and then have somebody to speak with. So I just want people to know these resources are out there. Both the Alzheimer's Association and the Family Caregiver Support Program are just great places to start if you have a family member who is living with dementia or experiencing even just memory loss, and you want to sort of talk through, how can I talk about this with my family member? Because that can be a very hard conversation to have. I think either of these resources can be helpful with that. So if we go to the next slide, I also wanted to share another program that's available statewide. And I asked them to put this in the link because this is something a lot of people don't know about. This is a learning portal, and it's free to anybody who is in Washington, caring for somebody in Washington. It is a free online training portal where you get in and there are community chats you can participate in. There are little mini webinars. If some of you have heard of Teepa Snow, who is a very popular trainer around dementia care and issues, there's a lot of little mini videos. They're short. They're like 3 to 5 minutes, little videos with clips on how to, you know, help with personal care, how to help with certain behaviors, where are some resources. So it can be a very good resources just out of your home. If you're a working caregiver and you need to have a resource at night, it is free. You go in from the state of Washington. It's pretty easy. You have to create a password, but you can get that, and they tailor it to the interests. They ask you, what are your interests? And they can feed you some information that would be good for you. So I just encourage you to look at that. And I did put that into the chat there. So you guys could just go and check it out and see what you can get there. Then if we go to the next slide, I wanted to talk about the Dementia Action Collaborative. I remember I did mention at the beginning that that's one of the programs that I coordinate. This is a group of about 60 different organizations that come together, individuals who are all working on dementia and want to make resources and services better for people who are living with dementia and their families. And on this website, and I'm going to click on that in the chat as well, on that website, you will find, if you scroll down, you see over on the right there, you see there's a QR code. If you want to get to that right now, you just point your camera, you'll get to our page. And right below that, you see we have special sections. One section for individuals and families, and another section for healthcare providers, another section on dementia-friendly communities. So if you're interested in this area and you want to see what kind of resources are out there that the Dementia Action Collaborative has been working on in all these areas, I just encourage you to go there and look around. People like Chris Rhodes, who you're going to hear from next, he is the chair of our Health and Medical Subcommittee, have been working hard over the last 5-6 years to create tools for healthcare providers to try to get information out about the trainings that they can offer. But there are a lot of tools that we've created for individuals and family members as well. So let's go to the next slide. And I just did want to share this Dementia Roadmap. If you haven't heard about it, it's one of our more popular items because it, in one sort of magazine type booklet, it shares the whole journey from the point where you're worried and wondering about, is this dementia? What is this? What's going on with my family, to the early stage, mid, and later stages. And in each section, it talks about what you can expect, action steps you could take, and what kind of resources you could reach out for. So if you're just starting on this journey or have a friend or family member who's starting on this journey, I encourage you to check that out. We have it available in English, Spanish, and Russian at this point. We also have, what you see on the right of the screen is a sort of safety toolkit. It really compiles just information on different concerns around safety for people who are living with memory loss or dementia. So things around making the home safer, things about falls, things about how do you talk to somebody about driving when maybe we're concerned that they should or shouldn't be driving, about wandering or people who might wander away from home. What are some protections that we might be able to find out about? So I encourage you, if that's an issue for you, to look into that safety toolkit on our webpage. If we go to the next page, we have another tool called the Dementia Legal Planning Toolkit. And this is for anybody who's interested in getting their stuff down in writing. We all really need to be working on having powers of attorney powers of attorney for healthcare, finances in place, ideally before something like dementia happens. So all of us should be working on that. But if you're just recently getting a diagnosis of mild cognitive impairment or thinking it might be dementia, make sure you look into this and start working on your legal and advanced care planning right away. Talk to your physician about it. If you need to talk to people in your family, this toolkit can help you understand what are some steps I need to take, what kind of things do I need to put into writing, and answer some of those questions. And when you open the folder, it gives you the forms right there, or you can view it online. That's available on our website. On the next slide, you'll see a really cool project that we have funded by the state legislature where we're working with volunteer attorneys across the state. We have attorneys that have been trained in this whole issue of helping people to complete their powers of attorney for healthcare finances, healthcare directives. For any adult 60 over or dementia of any age, you can get consultation with a trained attorney for free. Ideally matched up in your area. They will match you with somebody in your area if they have it. If it's not in your area, we might be able to create something like a Zoom or a virtual session with an attorney. So they don't do, complicated legal issues. It's really around completing these forms and getting them into place because it's so important that people have those in place. On the next slide, another thing we just want you to know that's available, we have some caregiver tip sheets. If you're faced with a challenge, like you can't get the person to take a shower, you can't get them maybe to see the need to change their clothes. Some of these challenging behaviors that we have around personal care, there's a whole lot of ideas and strategies you can use with families around some of the behaviors that people have with dementia, and also some tips on how can you solve some of those behavior problems, how can you work through them. On the next slide, I just want to real quickly tell you about a program we have called Dementia Friends Washington. And this is, again, funded by the state legislature. It comes out of the University of Washington Memory and Brain Wellness Center. And this is a program where we're really just trying to get people like you, everybody around, more aware of what is dementia and how could I help a friend or a neighbor who has dementia? How could I be a good friend to somebody who's living with dementia? And we have volunteer trainers out in each of the counties where you see a little blue person there, little blue person in the county. We have regional coordinators. And if you're interested in learning more about what's going on in your area, I just encourage you to go to this website, Dementia Friends Washington, and you can go down and look at your county and see who might I contact to get more involved and maybe become a dementia friend. Or there is an online dementia friend training if you're interested in that. And I have one more slide, just one last resource. We have been doing some public awareness campaigns, trying to create more materials that are tailored to different communities. So this is through the Department of Health. If you're just looking for some resources with little video clips, information about memory loss and dementia, I just encourage you to go to this site at doh.wa.gov/memory. And the Department of Health worked with Black and African American and Latino communities to tailor messages specifically to those communities so that there would be some materials that are reflective of their culture and their communities and have some translated materials as well. So I encourage you to go to that website and check that out as well. And that's it for me. I'll pass the baton to the next panelist.
All right, Monica.
Hi, everyone. I am so pleased to speak today about acquired brain injuries. This is a very complex and diverse patient population that I'm very passionate about. And I'll be just doing a brief overview, so I welcome any questions that come up after today's webinar. I want to start this presentation with a statistic that is compiled by the Brain Injury Association of America. Every 13 seconds, someone in the United States sustains an acquired brain injury, and this equates to at least 2.5 million documented cases annually. And the reason I share this statistic is to show its high occurrence and the importance of education and resources, both for survivors and their families. Next slide, please. So what is an acquired brain injury? An acquired brain injury, or ABI, more of an umbrella term, and under that there's two different types of ABIs, those being traumatic brain injuries, or TBI, and non-traumatic brain injury, or NTBI. A traumatic brain injury equates to an external force that disrupts brain functioning. So examples could be closed head injuries, the most common being falls, motor vehicle accidents, assaults, blast injury, versus penetrating head injuries like gunshot wounds, stab wounds. Non-traumatic brain injuries equate to internal changes that disrupt brain functioning, the most common being stroke, but other examples could include anoxic brain injury or lack of oxygen to the brain. This is most commonly sustained in near drowning events. Brain tumor, meningitis, encephalopathy as well. Next slide, please. So the impacts of ABI really depend on whether the injury itself is focal or confined to one area of the brain versus diffuse injury, which is more widespread. But common neurological symptoms can include somatic, so headache, pain, nausea, can also include sensory or processing disturbances, so changes in vision. Not uncommon for survivors to say that they have double vision or things feel blurry. Changes in taste and smell, changes in hearing and balance. We see changes in motor, and that can include walking, talking, eating, and swallowing. We also see neurobehavioral, and that can include changes in personality. It's not uncommon for family members to say, wow, my family member, they're completely different. And that can be really alarming for family members and really scary for survivors as well. And then finally, where I come in as a speech language pathologist, the cognitive communication sequelae. And that can include aphasia, or difficulty finding words or understanding language, changes in attention, memory, and executive functioning. I want to turn our attention to this image on the right side of the screen. This is an image I frequently show my patients and their family members to describe the overt and the covert layers that come with brain injury. It's not uncommon for brain injuries to be equated to an invisible injury, just because we frequently can perceive what we perceive at the surface. We might see a survivor who looks normal. They can talk, they can walk maybe, but what we can't appreciate is all of these different layers that survivors know all too well. Fatigue, I have anxiety, I have pain, I can't sleep. And this is really important work and something that survivors report to be the most difficult with their recovery, is trying to navigate a world that's black and white and advocate for their new normal. And next slide. So prevention, as talked by Maria and Lynn already, the best way to prevent non-traumatic brain injury being stroke, of course, healthy lifestyle factors. So nutrition, movement, all of those lifestyle factors are facilitators in helping a healthy brain. I will also mention the importance of wearing helmets for bike riding, riding a motorcycle, even horseback riding. Those are great things to implement. Resources I have compiled a list of resources that I'm hoping will be circulated after today's webinar, but just common ones. Brain Injury Alliance of Washington, wonderful organization. I will also give a shout out to my national board, which is the American Speech, Language, and Hearing Association. They have wonderful resources for pediatric brain injury as well as adult acquired brain injury. Support groups. Support groups are crucial both for survivors and family members. That connection and that social interaction is so, so important. One of the most common things I hear from survivors is that idea of isolation. Brain injury is really isolating, and support groups are so important. And last, I will give a shout out to my mentor, Dr. Rick Limoncello. He is the founder of Cerebellum's Bakery and Workshop, a play on words for the cerebellum, a part of our brain. It is located in Portland, Oregon. And it is a bakery that makes delicious cupcakes and brownies. And all of the workers are survivors of acquired brain injury. And it is so important to have that return to work, that sense of purpose. And it's such a wonderful, wonderful place. I would love to see something like this in Washington State. So a good opportunity for all of us to maybe get that in the works. But if you're ever in Portland, Oregon, give Cerebellums a shout out. They're pretty good cupcakes. And I appreciate being able to talk with y'all today.
Thank you. And next we'll go to Dr. Rhodes.
Again, I am pleased and honored to be here. I decided to forego slides, which is something I haven't done in probably 20 years, but we'll see how it goes. So I just want to emphasize a couple of points. One is the importance of brain health as a lifespan issue, from prenatal and perinatal health all the way to developing cognitive impairment in later life. There's wonderful work by the Lancet Commission that many of you may be familiar with that would indicate about 40% of all dementias are preventable. Right? So, and that's not necessarily the diseases that cause dementia are preventable, even something like Alzheimer's disease, but the idea that it would progress to the point that the clinical syndrome of memory loss and functional loss is apparent. Not everybody, right? And we see that here at our Alzheimer's Disease Research Center with people that we've followed longitudinally who have come to autopsy and have the most severe stages of the disease, but are still living with MCI or very early stage dementia. So that idea of being resilient to a disease process and it not manifesting in ways that impact our lives. So there's lots of great work to be done there and lots of great educational work to be done to help us understand the things we could and should be doing throughout our lifespan to optimize brain health and reduce the risk of dementia. There's also some really lovely population studies that come out of the Chicago area that would say the more of these things we do, things like staying physically active, not smoking, more of like a Mediterranean diet, keeping our brains active and staying socially engaged. If we do 4 or 5 of those things, it's almost a 60% reduction in developing the clinical syndrome that comes with diseases like Alzheimer's. And if we do 2 or 3, it's about a 30% reduction. So really great emerging evidence around the importance of lifestyle and maybe even offsetting some of that genetic risk that we might have. Where I think we run into some trouble, and this is the other point I wanted to bring up, is the stigma that accompanies dementia. And that stigma exists on both sides of the clinical equation. So there are patients and families who are experiencing changes or concerned about changes that don't bring these forward to their providers. And equally, there are providers that don't ask and don't know what to do about cognitive impairment. The work that we have done here at the state of Washington has shed some light on how motivated and interested providers are, but they lack the training and kind of the tools to be able to detect and diagnose dementia. And we lack the resources to send people to specialists right? So if any of you of the 100 or so people who are on here have ever tried to get into a memory clinic, the wait and the paperwork and the time and the expense is formidable. So we have undertaken efforts on both sides of that equation to help the public, and I count myself as part of the public, around destigmatizing dementia and bringing concerns up when they occur. And we're also embarking on these efforts to help primary and other specialty care providers detect, diagnose, and manage dementia with the people they know best, their patients that they've known for years in their communities, and then come up with some pathways of how do you get somebody who really needs a tertiary evaluation to a place like the University of Washington or the Center for Healthy Aging at Swedish. So lots of work that's underway. And I think the last thing that I want to tie those two things together with, that revisits some of what Maria so lovely talked about, was the idea that there are a number of things that masquerade as dementia, and hence the importance of an early and accurate diagnosis. So things not just like B12 and thyroid, but the things that we see a lot are undiagnosed and untreated sleep apnea, untreated and undiagnosed depression, alcohol or other substance use, medication side effects, including over-the-counter things, sensory loss, hearing loss, vision loss, all these things that once addressed, even if they don't bring somebody back to what their baseline should be, either improve cognition or reduce the risk for further cognitive impairment. And the further upstream we do those things, the wider the window of opportunity to move the needle on that. So I think I will stop there just in the name of time. And there's some great information from the Washington Cares Act that's coming up next. And I think we've got time for Q&A after that too. So I'll stop there.
Thank you so much. All right, so I am going to go ahead and share my screen again. Just one moment. All right, so next we are going to give an overview of the WAC Cares Fund and talk about how the program will be able to help folks in the future. So WAC Cares is a long-term care program for workers in Washington State. It's an earned benefit, which means that you contribute for a certain number of years in order to qualify for benefits. It's entirely self-funded from worker contributions, which go into a dedicated trust fund that's used only for this program. And workers contribute 0.58% of each paycheck to WAC Cares. You can see here what this looks like for the typical worker who makes just over $50,000 a year and would contribute $291 each year, or about $24 per month. You only contribute to WAC Cares while you're working. Contributions stop when you retire or if you become unemployed. And with WAC Cares, everyone is covered at the same rate, regardless of pre-existing conditions. When it comes time to claim your benefits, there's no need to file a claim or pay upfront for services. Instead, we connect you with contracted providers for the services that you want and pay those providers directly. Contributions to the program began in July last year, and benefits will become available in July 2026. This is what contributions look like over the course of a career. You can see that the typical worker's income is just about at the level in green here in the middle. And you can see that $290 in contributions each year totals out at $8,700 over 30 years. And almost all Washington workers contribute to WAC Cares. To determine whether someone is a Washington worker, we look at whether their work is localized in Washington. And that is a complicated concept sometimes, but because we use the same definition as the state's paid family and medical leave program, that gives us an easy rule to work from. So any workers who are included in paid leave will also be included in WAC Cares unless they have an approved WAC Cares exemption from the Employment Security Department. If you're not sure whether you participate in paid leave and WAC Cares, you can check your pay stub or ask your employer for more information. If your work is not localized in Washington, then you're automatically not included in paid leave or WAC Cares. No need to file for an exemption. Federal employees are also not included, and employees of tribal businesses are only included if the tribe has opted in. And self-employed people are also only included if they opt in. Other workers can get an exemption from Walk Cares, which they must apply to the Employment Security Department to get. And you can see a list here on your screen. And if you're interested in more information on exemptions, you can visit walkcaresfund.wa.gov/exemptions. If you are self-employed, you can also choose to opt into the Walk Cares Fund and protect yourself with the same affordable benefits that are available to other Washington workers. Like other workers, you contribute 0.58% of your earnings, including your net earnings and any gross wages that are paid to you by your business. And if you're interested in learning more about opting in, you can visit walkcaresfund.wa.gov/opt-in. Let's talk a little bit about how you qualify for Walk Cares benefits. So everyone who is contributing to Walk Cares more than 500 hours per year is earning benefits, part-time and temporary workers included. And by contributing for a certain number of years, you earn access to the benefit amount. So there are 3 pathways to meeting the contribution requirement. The first is lifetime access. And this is the pathway that we expect most Washington workers will use to qualify for benefits. So to use this pathway, you must contribute for 10 years without a break of 5 or more consecutive years. And this pathway earns you access to the full benefit amount, which is $36,500, an amount that will grow over time with inflation. The next is early access. This is for workers who have not yet earned lifetime access, but have a care need while working or soon after leaving work. And to qualify, you need to have contributed for at least 3 of the last 6 years at the time that you need care and apply for benefits. This pathway also earns you access to that full benefit amount. And finally, we have a special pathway that is just for people who are near retirement. So if you were born before 1968 and are therefore near retirement as the program is beginning and unlikely to be able to qualify for lifetime access to the full benefit amount, you earn 10% of that full amount for each year that you work. So for example, if you work and contribute for 500 or more hours per year for 3 years, you would earn 30% of the benefit amount. And near retirees have permanent access to whatever percentage of the benefit amount they earn at any time that they need care, and are also able to qualify through one of those other pathways if they meet those requirements. Once workers meet contribution requirements and need help with at least 3 activities of daily living, they can get access to a $36,500 budget for services and supports. And again, that amount increases over time with inflation. And with Walk Cares, you get the flexibility to choose the services and supports that meet your needs. So that could mean in-home or residential care, but it could also include things like home modifications to make your home safer, and assistive technology for things like medication reminders and fall detection that can help for some care needs, or services like home delivered meals and transportation. Walk Cares is really designed to help people age in place in their own homes for as long as possible. That's what almost all of us want to do, and most of us can if we have the right supports in place. Walk Cares also has many options that are designed to provide support for family caregivers. So you can choose someone who would otherwise be caring for you on an unpaid basis to get training and be paid, even your spouse. And Walk Cares can also help lessen the impact on family caregivers by making sure they can get other support services or respite care. These are just some examples of how far the benefit amount will go. These are also available on our website at walkcaresfund.wa.gov/benefits. I'm going to skip over the details of these just with an eye towards time and making sure that we can answer all the questions in our Q&A. And I also will not go into a ton of detail, but do want to mention that we have some great news from legislative session this year. The legislature passed a new law that allows people to take their Walk Cares benefit with them if they move out of state. So under that new law, starting in July 2026, you can continue to participate in Walk Cares if you move out of state. And there are more details on that available on our website as well if you're interested. And that brings us to the audience Q&A. So I'm going to stop the screen share and we will take a look at the questions that we've got. So our first question is, directed to Dr. Rhodes, who's asking if you have information on a study on early onset dementia that has a genetic disposition, coming from a family with a lot of folks diagnosed with early onset dementia, all before the age of 55. Is that something you're able to share any info on?
Sure. I don't know if there's a particular study that the attendee is asking about, but what I can share is, about 2 to 5% of all cases of dementia are genetic for Alzheimer's disease. That proportion's a little higher for things like frontotemporal dementia, but for the most common thing that causes dementia, Alzheimer's. So 2 to 5% are genetic. They tend to be early onset cases. So these would be people who are in their 30s, 40s, 50s, before the age of 65, which gets a little tricky sometimes when you think about the difference between early onset and early stage. But this would be referring to the time in life that somebody develops symptoms. And there are 3 genes that predominantly drive those 2 to 5% of all cases. So yes, and they tend to be heavily kind of familial. So they're pretty well identified. There are a handful of other kind of candidate risk genes that also seem to interact with some other health conditions that drive onset pre-65. But the vast majority of cases are, at least genetic dominant. So there's a genetic maybe risk like ApoE4 status, but these epigenetic phenomena in our lives that either turn that risk on or off, or kind of activate it or deactivate it. The other thing, since I'm talking, I saw that message in there about it's nice to have slides for those without a strong verbal memory. So while Kristen was talking about her part, I just put together 10 and I'll send them to the group who can distribute it later today. So there you go.
We can add that to our materials. I'm also dropping in the chat a couple of additional TBI resources that may be of interest for folks. Got someone asking, just a quick follow-up, Dr. Rhodes, that you said over-the-counter medications, asking about which over-the-counter medications. It sounds like that's new info for this participant.
Yeah, there are a couple that are particularly concerning around memory and cognition, and they tend to be things like diphenhydramine, so Benadryl, and then some of the doxylamine, so the like Tylenol PM, the things that help with sleep tend to have anticholinergic side effects or memory impairing side effects. So those are always things that, a good pharmacist can take a look at those. Primary care, always important to, bring your medications, including things that are over the counter, because we don't always think about those as having some risks to them, but always worth a good review of medications.
Thank you. Okay. So we're gonna take a few Walk Cares questions. We've got one person asking for Walk Cares how many years someone needs to contribute in order to receive benefits. And I will share my screen again. We're gonna back up to that slide. I know we breezed through some of the Walk Cares info, but sorry. There we go. So this is the amount of years that folks need to contribute in order to qualify. So for a worker who contributes for a total of 10 years without a break of 5 or more years, they'll be able to access the full benefit amount. Or if you need early access to your benefit but haven't yet earned that lifetime access, if you contributed at least 3 of the last 6 years when you need care, you will be able to access the full amount. And then finally, near retirees are able to access 10% of the full benefit amount for each year that they work, to make sure that they are still able to have permanent access to the benefit, even if they haven't earned that full lifetime access because of when they're retiring. And then let's see, we've got someone asking about whether Walk Cares will be able to pay family caregivers, and will the process be similar to other programs like CFC and COPES? So we are still working out what exactly the process is going to look like for paying family caregivers. but paid family caregivers are a covered benefit for walk cares. We've also got someone asking for the qualifying years for earning benefits. Is that for each year they worked after 2021? It's for each year starting in July of last year. So after 2023, starting in 2023. And then we've got someone asking about new hires who didn't opt out of the Walk Cares program because they weren't working 2 years ago. If there's a continuing opt-out provision for those workers, know the opt-out for private insurance was designed as a one-time opportunity for folks who were already covered by private insurance when the Walk Cares program went live to be able to opt out. So that window has closed for applications and is not available on an ongoing basis. And then finally, we've got a couple other Walk Cares questions. We've got someone asking whether cognitive impairment is one of our official activities of daily living or impairments that helps you qualify to be able to use your benefit. And cognitive impairment will be considered in our care needs assessment. So people who can physically complete activities of daily living like eating or bathing, but who need supervision like prompting, reminders, or monitoring in order to do that activity will still be able to qualify for care based on needing help with that activity. That will count towards their 3 activities of daily living. And then we've also got someone asking about whether paid family and medical leave duplicates Walk Cares and can it be tapped along with Walk Cares. So paid leave and Walk Cares are kind of 2 separate programs designed to, in some ways work similarly, but paid leave is really designed to help replace your income if you experience a serious health condition that prevents you from working, if you need time off to care for a family member or to welcome a new child or for certain military related events. So it's similar to disability insurance. Walk Cares is designed to be used to pay for long-term care. So it's for the person who needs care. So there may be a situation where a family caregiver is able to get paid family and medical leave in order to take time off to provide care for their loved one, and that loved one's Walk Cares benefits can be used to pay for care. There may also be some people who need care early in life, maybe while they're still working, who might be able to get paid medical leave to help replace their income, and depending on their care need, might be able to use their Walk Cares benefit to get the care that they need, but they're sort of designed to pay for 2 different parts of the situation when someone needs care or needs help. And then we've also got someone asking, are there resources in other states for someone who lives out of state that suffers from TBI? Do we have any maybe national links, either Lynn or not, sorry, not Lynn, Monica, or that we can share there?
Yeah, in the resource list that I compiled that I hope will be circulated, my national board is a great organization, as well as the Brain Injury Alliance Association. I know that the latter has links for support groups that meet in person and are virtual as well. And then I would have to do some digging about other state if they have something similar to what we have with our 211 line. I'm not familiar with that.
Yeah, we will be posting those additional resources with the slides later today. So hopefully that will be helpful for you in looking for similar resources in other states. Okay, that brings us to the end of the questions that were submitted. I'm just going to share one more slide with you all briefly. So this is our contact information and some links to our website and to contact us if you have additional questions after the webinar. You can contact us by email or by phone. We'd love to hear from you. And with that, I'm going to go ahead and close out the webinar for today. Thank you so much for joining us. And we look forward to seeing you next month for our Walk Cares Basics for Employers webinar, if that is of interest to you. And otherwise, we will see you for our next Walk Cares Conversations webinar in August. Thank you all so much for making the time today.